Child health nursing. 1. Which of the following factors needs to be included in a teaching plan for a child with sickle cell anemia? Select all that apply. The child needs to be taken to a physician when sick. The parent should make sure the child sleeps in an air-conditioned room. Emotional stress should be avoided. It is important to keep the child well hydrated. It is important to make sure the child gets adequate nutrition. The answers are: A. The child needs to be taken to a physician when sick. C. Emotional stress should be avoided. D. It is important to keep the child well hydrated. E. It is important to make sure the child gets adequate nutrition. 2. The state obliged performs some type of newborn screening on each newborn client. The main purpose of this blood test procedure is assessment of the visual acuity of the newborn client, screening the newborn client for hearing loss, evaluation of each newborn client for autism, detection of disorders not readily apparent at birth. The answer is D. Detection of disorders not readily apparent at birth. 3. Which treatment would the nurse anticipate for a 2-week-old boy diagnosed with PKU? There is no treatment or special diet. A high phenylalanine diet. A low phenylalanine diet. The mother would be advised not to breastfeed the infant. The answer is C. A low phenylalanine diet. 4. Which teaching would be important to discuss with the family of a child born with PKU? Studies have shown that children with PKU outgrow the disease. Consumption of decreased amounts of protein and dairy products is advised. High protein and high dairy products consumption must be maintained. Exclusive breastfeeding is encouraged for maximal nutrition for the child. The answer is B. Consumption of decreased amounts of protein and dairy products is advised. 5. Which intervention should the nurse implement for a newborn diagnosed with galactosemia? Eliminate all milk and lactose-containing foods. Encourage breastfeeding as long as possible. Encourage lactose-containing formulas. Avoid feeding soy protein formula to the newborn. The answer is A. Eliminate all milk and lactose-containing foods. 6. Which statement by the parent of a newborn male diagnosed with galactosemia demonstrates successful teaching? This is a rare disorder that usually does not affect future children. Our newborn looks normal, he may not have galactosemia. Our newborn may need to take penicillin and other medications to prevent infection. Penicillin and other drugs that contain lactose as fillers need to be avoided. The answer is D. Penicillin and other drugs that contain lactose as fillers need to be avoided. 7. The nurse is caring for a newborn with esophageal atresia. When reviewing the mother's history, the nurse would expect to find which of the following: a history of maternal polyhydramnios, a pregnancy that lasted more than 38 weeks, a history of poor nutrition during pregnancy, a history of alcohol consumption during pregnancy. The answer is A. A history of maternal polyhydramnios. 8. The nurse is caring for a newborn who has just been diagnosed with tracheoesophageal atresia and is scheduled for surgery. Which of the following should the nurse expect to do in the preoperative period? Keep the child in a monitored crib, obtain frequent vital signs, and allow the parents to visit but not hold their infant. Administer intravenous fluids and antibiotics. Place the infant on 50% oxygen via a non-rebreather mask. Have the mother feed the infant slowly in a monitored area, stopping all feedings 4 to 6 hours before surgery. The answer is B. Administer intravenous fluids and antibiotics. 9. The nurse is caring for a 7-week-old scheduled for a pyloromyotomy in 24 hours. Which of the following would the nurse expect to find in the plan of care? Keep infant NPO. Keep infant NPO. Begin intravenous fluids at maintenance. Place NGT to low wall suction. Obtain serum electrolytes. Keep infant NPO. Do not attempt to pass NGT due to obstruction from pylorus. Offer infant small frequent feedings. Keep NPO 6 to 8 hours before surgery. The answer is B. Keep infant NPO, begin intravenous fluids at maintenance, place NGT to low wall suction. 10. The parents of a child being evaluated for celiac disease ask the nurse why it is important to make dietary changes. Select the nurse's best response. The body's response to gluten causes damage to the mucosal cells in the intestine, leading to absorption problems. When the child with celiac disease consumes anything containing gluten, the body responds by creating special cells called villi, which leads to more diarrhea. The body's response to gluten causes the intestine to become more porous and hang on to more of the fat-soluble vitamins, leading to vitamin toxicity. The body's response to gluten causes damage to the mucosal cells, leading to malabsorption of water and hard, constipated stools. The answer is A. The body's response to gluten causes damage to the mucosal cells in the intestine, leading to absorption problems. 11. The nurse is caring for a 14-year-old with celiac disease. The nurse knows that the patient understands the diet instructions by ordering which of the following meals? Eggs, bacon, rye toast, and lactose-free milk. Pancakes, orange juice, and sausage links. Oat cereal, breakfast pastry, and non-fat skim milk. Cheese, banana slices, rice cakes, and whole milk. The answer is D. Cheese, banana slices, rice cakes, and whole milk. 12. The nurse is caring for an infant newly diagnosed with Hirschsprung disease. Which of the following does the nurse understand about this infant's condition? There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. There is a small bowel obstruction leading to ribbon-like stools. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. The answer is A. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 13. The nurse is caring for a 5-month-old infant with a diagnosis of intussusception. The infant has periods of irritability during which the knees are brought to chest and the infant cries, alternating with periods of lethargy. Vital signs are stable and within age-appropriate limits. The physician elects to give an enema. The parents ask the purpose of the enema. Select the nurse's most appropriate response. The enema will confirm the diagnosis. If the test result is positive, your child will need to have surgery to correct the intussusception. The enema will confirm the diagnosis. Although very unlikely, the enema may also help fix the intussusception so that your child will not immediately need surgery. The enema will help confirm diagnosis and has a good chance of fixing the intussusception. The enema will help confirm the diagnosis and may temporarily fix the intussusception. If the bowel returns to normal, there is a strong likelihood that the intussusception will recur. The answer is C. The enema will help confirm diagnosis and has a good chance of fixing the intussusception. 14. What does the therapeutic management of cystic fibrosis patients include? Select all that apply. Providing a high-protein, high-calorie diet. Providing a high-fat, high-carbohydrate diet. Encouraging exercise. Minimizing pulmonary complication. Encouraging medication compliance. The answers are A. Providing a high-protein, high-calorie diet. C. Encouraging exercise. E. Encouraging medication compliance. 15. A 5-month-old has been diagnosed with an ASD. The flow of blood through the heart with this type of defect is right to left, equal between the two chambers, left to right, bypassing the defect. The answer is C, left to right. 16. The nurse is caring for a 3-month-old with a VSD. The physicians have decided not to repair it surgically. The parents express concern that this is not best for their child and ask why their daughter will not have an operation. The nurse's best response to the parents is It is always helpful to get a second opinion about any serious condition like this. Your daughter's defect is small and will likely close on its own by the time she is 2 years old. It is common for the physicians to wait until an infant develops respiratory distress before they do the surgery because of the danger. With a small defect like this, we will wait until the child is 10 years old to do the surgery. The answer is B. Your daughter's defect is small and will likely close on its own by the time she is 2 years old. 17. A 2-month-old with TOF is seen in your clinic for a checkup. During the examination, the child develops severe respiratory distress and becomes cyanotic. The nurse's first action should be to lay the child flat to promote hemostasis. Lay the child flat with legs elevated to increase blood flow to the heart. Sit the child on the parent's lap, with legs dangling, to promote venous pooling. Hold the child in knee-chest position to decrease venous blood return. The answer is D. Hold the child in knee-chest position to decrease venous blood return. 18. During play, a toddler with a history of TOF might assume which of the following positions? Sitting, supine, squatting, left lateral recumbent. The answer is C. Squatting. 19. Which statement by the mother of a patient with RF shows that she has an understanding of prevention in her other children? Whenever one of them gets a sore throat, I will give that child an antibiotic. There is no treatment. It must run its course. If their culture is positive for group A streptococcus, I will give them their antibiotic. If their culture is positive for staphylococcus A, I will give them their antibiotic. The answer is A. Whenever one of them gets a sore throat, I will give that child an antibiotic. 20. The nurse received a report on a new admission, a 3-year-old with Kawasaki disease. Understanding the etiology and major complications of Kawasaki disease, the priority nursing intervention would be continuous cardiovascular and oxygen saturation monitoring. Vital signs every 4 hours until stable. Strict intake and output monitoring hourly. Begin aspirin therapy after fever has resolved. The answer is A. Continuous cardiovascular and oxygen saturation monitoring.